Hi, I'm Graeme. In this video I'll be showing you how to treat your trigger points at home. This is not your typical trigger point releases that usually get shown on YouTube. They just give short-term relief but don't fix the problem. And instead we're looking at an effective professional grade therapy with a view to long-term improvement. Now, I've got a separate video on what trigger points are, which I'll link above. But as a quick summary, they're parts of your muscle that have spasmed or bunched up, forming a lump. Now that lump continues to grow, first causing muscle tightness and fatigue, then eventually causing pain. The trigger points are usually involved in most musculoskeletal pain syndromes such as back, neck and shoulder pain, and they continue to be a problem because they're often not diagnosed, or if they are diagnosed, they're poorly treated. So let's get on with how to fix them. Now this video has 3 sections: how to find trigger points, how we treat them, and then some general advice to help you get rid of them and not develop more. Standard disclaimer, this is general information only. For specific advice, please consult your own healthcare professional. To find your trigger points, you need to know what to look for and where to look. Now, as I said before, trigger points are part of your muscle that's bunched up, forming a lump. Now this tightens the muscle around it while the lump becomes tender and shoots pain when pressed upon. Now this is what we look for. Now I'll show you how we do this using my forearm where it's easy to see. Now use the flats of your fingers, systematically examine all of the muscles, looking for any parts that feel a bit tight or tender. Now if you do, use the tips of 1 or 2 fingers to examine deeper, looking for tender lumps that shoot pain. They're the trigger points. So, where do you look? In general, scientists have developed charts like these. If you get pain in a certain area, it tells you which muscles to look at. Now, for each of those muscles, we have charts like these showing the common trigger points and where they shoot pain. But I've done all that for you already. We've got guides covering most musculoskeletal pain syndromes, such as the one here for back pain. They have diagrams of all the muscles, specific techniques, plus all the other stuff you need to know. Now, I'll link a lot of those guides in the description. For treating trigger points, I'll show you 2 ways. Now, the first works fair to reasonable and doesn't need any special equipment. Now, the second is easier and more effective, but you need the proper equipment. The first way is the basic pressure release, which just about everyone shows you. Now, as the name suggests, again, demonstrating my forearm, you apply the pressure to the trigger point and then release the pressure. Now, if you can reach the part, you can use your fingers or thumbs. Now, for parts you can't reach, you can often apply pressure using something like this or even a ball. Now, for specific techniques, just check out the guides I mentioned. They have all that stuff. Now, warning about things like laying on balls. Now, it's easy to apply too much pressure and hurt yourself, which I've seen a lot of people do. So, if you do need to do that, be careful. Now, when most people do pressure release, they apply painful pressure until the pain fades. Now, that's hard to do on yourself, and with too many people, that pain is damaging something rather than doing good. The good news is that scientists have found that using repeated applications of moderate pressure works well. So instead of the painful, potentially damaging pressure, they use moderate pressure for 10 seconds and then repeat about 5 times. Now this pic is from a trial where they did that. They used that mechanical contraption to apply pressure to the trigger points in their upper back. The second technique is much easier, more comfortable and more effective, but you need a proper professional grade vibration massager. Now, I'll link full instructions, but basically you just sit the machine over the trigger point and let the vibrations penetrate. There's no pain, no pressing in that can do damage, and to use non-technical terms, the vibrations penetrate and dissolve the trigger points. If you have a professional standard personal use machine like one of these with an ergonomically designed handle, it lets you treat anywhere on your body. Now, for example, if you have a trigger point in the middle of the back, instead of trying to apply pressure with something like this, or laying on a ball, you just hold the machine on the right spot. Now, a word of warning though, most personal use vibration massages you can buy won't be suitable. Now, there's a lot like this that have weak motors and mechanisms and are not really serious therapeutic devices. Now, as a demonstration, if I put this on my forearm, I can feel the vibrations going right through the muscle underneath. And on the other hand, this one is barely buzzing the surface. Now, massage guns aren't suitable either. Now, looking at the obvious, they haven't got proper handles, so unless you have arms like Inspector Gadget, you won't be able to reach a lot of your body yourself. However, there's a much bigger problem. Now, the easiest way to explain this is to use the analogy of these two machines. Vibration massages are like the yellow machine, designed to sit on the surface and send in therapeutic vibrations. On the other hand, massage guns or percussion massages are like the jackhammer, designed to pummel the surface. The massage gun marketers make a lot of misleading claims, but simply jackhammers are nowhere near as good at sending in therapeutic vibrations as a proper vibration machine. Now, marketers claim that driving the heads in makes them penetrate better, but professional strength therapeutic vibrations can go right through you like ultrasound, so that claim is totally false. Really, the only thing driving the heads in like a jackhammer is proven to do is cause injuries, which they do. Now, I'll link a guide on how to choose a proper machine, but when we were looking for a personal use massager our patients could use, I wasn't really happy with anything I could find, so we built our own. And that was one I showed you before. Now, we've got those available online and through a network of professionals who use and recommend them. Now, I'll link to those as well. Lastly, I'll go over some things that will help you get far better results and even avoid developing problems in the first place. Now, first, there's a lot of things we do that cause trigger points to develop and stop them getting better. The more we can reduce or eliminate those, the better. Now, I'll link details about that in the description. Now, one of the main causes is muscle tightness, which, as this diagram shows, puts pressure on the blood vessels, restricting blood flow. Now, anything you can do to keep your muscles nice and loose will help. Now, for example, people tend to tighten up sitting at desks for a long time, and office workers get lots of trigger points in their neck and shoulders. Now, that can be reduced dramatically by taking regular breaks with either stretches or light exercises. Next, like most health problems, it's much easier if you find and take care of the problems early. Looking at this diagram showing trigger point development, trigger points start small and you don't know they're there unless a therapist presses on them. And they can grow for years or even decades and start causing muscle tightness and fatigue. But those changes are gradual and they usually go unnoticed. Now finally, something aggravates them and you get shooting pain. If you do the self-examination treatment I've shown you, or see a massage therapist for regular massages to stay healthy, the trigger points can be found when they're small and easy to take care of. You avoid getting gradually stiffer and more tired and eventual pain. If they are left long enough that you do get pain, you need to understand that most courses of professional therapy do just like shown in the large blue arrow in this diagram, which stops the trigger points hurting and reverts them back to like they were before they were aggravated. Now, it's not nice having pain, but they're still large trigger points. You'll still get the muscle tightness and fatigue, and of course, next time you aggravate the trigger point, there'll be pain all over again. To get rid of the trigger point, you need to keep working on them and do things like reducing or eliminating the things that cause them. I'll link a guide with a lot more info about that. But understanding that, you're able to get much better long-term results using the home techniques than using professional exclusively. Now let me explain why. Treatment for treatment, the vibration massage I showed you is as effective, if not more so, than any professional treatment. However, just say you're getting a course of needles or laser. Now you might get a session each week for say 6 weeks and feel much better, but all you've done is a large blue arrow. Now, appointments take time and cost money, so that's it. You're feeling better, but left with large, well-developed trigger points that will hurt again when they're aggravated. Now, if you use self-therapy with vibration massager, it's easy and you don't have to fork out each time. Now, instead of waiting a week each time, you might do it each day, so you get better faster. Now, once you're out of pain, instead of leaving them only partially fixed, you can continue maybe spending a few minutes each week and the trigger points will gradually diminish. The trigger points take a long time to develop, and so it may be a slow process, but you keep at it and they'll gradually get better. Now, the last piece of advice that I have is that any sort of pain syndrome, trigger points are usually just part of the problem. Now, as a chiropractor, most of the people I saw had things like restricted joints and other biomechanical issues, long-term deconditioning of muscles, and all sorts of other stuff. Absolutely take care of the trigger points, but don't hesitate to get some professional help as well. Now, especially if it's stubborn or the pain keeps reoccurring. Now, if you have any questions or comments, please don't hesitate to ask, and if you found this useful, please leave a comment or a like. Hey, thank you very much for watching. It's been most appreciated.